Welcome to Healing Horizons. I'm Chris Daniels, and today we're exploring Ibogaine for veterans with PTSD and why Mexico is becoming ground zero for healing. If you're a veteran, a family member, or a clinician seeking credible guidance, this episode cuts through hype and fear to deliver clear, actionable insight. We'll look at what Ibogaine is, how it may help with trauma and co-occurring addiction, exactly what the treatment experience involves, why Mexico leads in access and safety protocols, and how to choose a reputable clinic. I'll also share real stories of change, risks to consider, and the integration steps that anchor breakthroughs into daily life. Let's start with the landscape. Many veterans live with hypervigilance, intrusive memories, sleep disruption, chronic pain, moral injury, and survivor's guilt. Standard treatments: SSRIs, SNRIs, prazosin, prolonged exposure, and EMDR help many, but not all. Some hit a wall, side effects, minimal response, or relapse under stress. Substance use becomes self-medication. Alcohol, opioids, benzodiazepines, stimulants, often worsening sleep and mood. In this context, Ibogaine draws attention not as a cure, but as a catalyst that may unstick entrenched patterns so therapy can work better. Ibogaine is an alkaloid from Tabernanthe iboga, a shrub native to West Central Africa. In Gabon, Cameroon, and the Republic of the Congo, iboga is central to Bwiti spiritual traditions. Respecting these roots matters. Modern clinics typically use ibogaine hydrochloride, an isolated compound with predictable dosing, rather than whole root bark. Iboga contains multiple alkaloids. Ibogaine is one, metabolized into noribogaine. Medical practice differs from ceremony, yet programs can honor lineage through education, cultural humility, ethical sourcing, and reforestation efforts. Mechanistically, Ibogaine is pharmacologically messy. It modulates NMDA and sigma receptors, impacts glutamate, and interacts with kappa opioid and nicotinic systems. Noribogaine appears to inhibit the serotonin transporter, increasing synaptic serotonin, and may influence dopamine tone relevant to craving. On trauma, early data suggest Ibogaine can promote neuroplasticity, windows when the brain is more malleable. That may support memory reconsolidation, revisiting traumatic material with less fear and updating it with new meaning. Many veterans describe fewer nightmares and less startle. What is the experience like? Preparation spans 2 to 6 weeks. Medical screening, medication adjustments, nutrition, electrolyte optimization, and psychological readiness with clear intentions. On site, a small test dose confirms tolerance, followed by a calculated flood dose based on weight, ECG, and clinical judgment. The acute phase lasts 12 to 24 hours, often a waking dream, with symbolic life review and somatic sensations. The next 24 to 72 hours are quieter, resting, hydrating, journaling. The afterglow can last days to weeks and must be integrated deliberately. Where's the evidence? Decades of case reports and observational studies show rapid opioid withdrawal attenuation, reduced cravings, and improved mood and PTSD symptoms for some. Small prospective cohorts document decreases in PCL5 and depression scores. But we lack large randomized trials, long-term comparisons, and standardized protocols. Adverse events, including rare cardiac arrhythmias and fatalities, have occurred, often linked to poor screening, interactions, or unmonitored settings. Ibogaine is not FDA approved and is illegal in several countries. Promising signals, real risks, and a clear need for rigorous research. Why Mexico? The regulatory environment allows medically supervised Ibogaine when clinics follow standards. Mexico hosts experienced providers, including veteran-focused programs staffed by cardiology consultants, anesthesiologists, and trauma therapists. Proximity helps. For North Americans, travel is straightforward, with airports near centers and hospitals. Cost is often more accessible than Europe and includes comprehensive care. A maturing ecosystem, peer networks, integration coaches, and nonprofit oversight has raised the bar. Choose wisely, and Mexico becomes a growing center of excellence, not a gamble. Safety is non-negotiable. Gold standard clinics require pre-screening, 12-lead EKG with QTC, echocardiogram when indicated, metabolic panel, CBC, liver enzymes, magnesium, potassium, and pregnancy testing when relevant. On-site, continuous cardiac and pulse ox monitoring, frequent vitals and electrolyte management are standard. An ACLS-trained team, defibrillator, IV access, oxygen, and transfer agreements with a nearby hospital are essential. Doses are individualized. Redosing is conservative. Hydration, non-QT prolonging antiemetics, and avoiding stimulants reduce risk. Abnormal QTC, electrolyte imbalance, recent MI, arrhythmia history, or uncontrolled hypertension defer treatment. Medication interactions matter. QT prolonging drugs, certain antipsychotics, methadone, some antidepressants, some antibiotics, compound risk. Many clinics taper methadone or long-acting buprenorphine, bridging to short-acting opioids before Ibogaine, then carefully managing after. Serotonergic agents may need tapering. MAOIs are contraindicated. Benzodiazepines can blunt insight, yet are sometimes used in microdoses for safety. Plans are individualized. People with structural heart disease, Brugada syndrome, uncontrolled hypertension, severe liver disease, uncontrolled seizure disorders, or acute psychosis should avoid Ibogaine. For TBI, obtain careful neuroevaluation. Do not self-taper. Coordinate changes with medical supervision. What does a veteran-focused pathway in Mexico look like? It begins with confidential intake and records review, followed by telehealth pre-screening with medical and psychological teams. Arrival day includes labs, EKG, and orientation. Treatment day features quiet rooms, dim light, minimal stimuli, and one-to-one monitoring. After dosing, a low-stimulation recovery period helps regulate sleep and circadian rhythm. Programs tailor care for co-occurring issues common in veterans. Chronic pain strategies, sleep hygiene, TBI-aware pacing, moral injury processing with chaplaincy or meaning-making frameworks, and substance use relapse planning. Family calls are structured, brief, and supportive to avoid emotional overload while maintaining connection. Integration cements benefits. Clinics schedule therapist-led sessions to translate insights into plans. Sleep routines, triggers, boundaries, movement, service, and community. Trauma-informed modalities, EMDR, somatic experiencing, mindfulness, and internal family systems help reconsolidate memories and build regulation. Peer mentorship with other veterans reinforces accountability. Telehealth check-ins at 1, 4, and 12 weeks monitor mood, craving, and sleep. Some programs pair Ibogaine with ketamine or 5-MeO-DMT. Upsides include added neuroplastic windows. Downsides include overload, cardiac stacking if timed poorly, and confusing narratives. Informed consent, medical clearance, and timing weeks apart are critical. The cultural and ethical dimension matters. While medical delivery differs from Bwiti ceremony, honoring indigenous knowledge means acknowledging origins, avoiding appropriation, and supporting ethical supply chains and reforestation. For veterans, spiritual humility can soften rigid self-judgment and reopen purpose. Avoid psychedelic tourism. Seek care, not spectacle. Choosing a reputable clinic. Verify licenses, on-call cardiology, ACLS coverage 24/7, continuous monitoring, and written emergency protocols. Ask about QTC thresholds, electrolyte management, hospital distance, inclusion and exclusion criteria, taper plans, and informed consent that explains risks plainly. Travel and legal logistics are straightforward but important. Ibogaine is unscheduled in Mexico when delivered within medical standards, but it remains illegal in the United States. Do not transport any medicine across borders. Bring a valid passport, medical records, medication lists, and emergency contacts. Choose flights that allow rest after treatment. Avoid long drives immediately post-Ibogaine. Privacy policies should be explicit. Veteran status is confidential. For families, set expectations. brief check-ins, no heavy processing by phone, and a homecoming plan that includes quiet time, safe sleep, nutritious meals, and help with appointments. Identify a local clinician willing to collaborate on aftercare. What have veterans reported? One Marine described waking without the usual jolt of dread for the first time in years. I didn't forget what happened. It just stopped owning me. A former medic saw alcohol cravings drop from daily to rare, while nightmares fell from 5 nights a week to 1 or 2 a month. Another regained capacity to sit with family at a restaurant without wall scanning. Not everyone has dramatic relief. Some face fatigue, unease, or grief. Integration and ongoing therapy shape durability. If you're exploring next steps, start with reputable organizations. The Global Ibogaine Therapy Alliance publishes safety guidelines and clinician resources. Veterans-focused nonprofits in Mexico and the U.S. sometimes offer scholarships or sliding scale support. Ask clinics for current partners rather than GoFundMe-only models. Integration networks, licensed therapists trained in psychedelic-informed care, peer groups, and telehealth coaches provide continuity after you return home. Establish a crisis plan. National and local suicide prevention hotlines, the VA Veterans Crisis Line, and nearby emergency departments. Ibogaine is not a substitute for inpatient psychiatric care, detox in unstable patients, or emergency services. Nothing here is medical advice. Decisions should be made with qualified clinicians who can review your full medical history. That's our episode. Today, we examined why veterans are seeking alternatives when standard care falls short, what Ibogaine is and its respectful connection to Bwiti traditions, how it may influence neuroplasticity, memory reconsolidation, and cravings, what a medically supervised experience looks like from preparation through afterglow, the current evidence and its limits, why Mexico has become a hub, non-negotiable safety practices, medication interactions and exclusions, the veteran-specific care pathway, integration, adjunct therapies, and timing, cultural and ethical considerations, practical travel and family planning, real stories of change, and resources and safeguards to keep you safe. The big picture. Ibogaine is not a panacea, but in the right hands it can open a window for meaningful healing and renewed purpose. If this resonated, share it with someone who might benefit, speak with a qualified clinician, and vet any program against the safety checklist we discussed. I'm Chris Daniels, and this is Healing Horizons. Thank you for listening and for your service. Until next time, be safe, stay connected, and keep moving toward wholeness.